everyone, and this is Coach Tess from HealthEversity, and today we are going to do Path and Lab. Now, Path and Lab, they're basically doing testing, identifying, all of these things. So they're not doing surgical procedures. They're basically doing other things within the CPT rather than surgery. Okay, so they send stuff to the library, the laboratory, plus they might be sending it, you might have doing autopsy. They're doing all of these things. They're looking at specimen, right? And a lot of the things to identify, possibly to come up with a diagnosis or something to that effect. So we're going to make it really simple and easy. So see, I have two different markers here. Normally in surgery, I had just identified all of those with a green marker, but now see, I have these two. Okay, the blue and the green. So this one just give me an idea what it is in pathology, to say if it's they're identifying, they're examining, but it's not a surgical procedure. Remember that. They're just looking at specimen and doing stuff like that. All right, so let's jump right in it. So we're focusing a lot on the CPC stuff that goes into the CPC exam on the Path and Lab. Okay, so we are going to jump right into it, and we're going to get our book, and I'd use it this way. So just like how you'd study, how you'd actually read. Okay, so now I've identified with the put in here. So they have the autopsy, and they're doing an examination of pretty much of a dead body, right? Okay. So you have, now you're going to see a lot of ology in Path and Lab. A lot of these terms that you're going to see are in your AAPC study guide. You look at the back of the glossary, like I normally tell you, it's in alphabetical order, and you find majority of these terms, right? This is an AAPC book that I study from, and I used it when I was using for my board exam. It's the same material. It ain't going to change. The body not going to change. Okay? All right, so let's look into, you're going to see a lot of ologies now. Okay, so you have autopsy, examination, bacteriology, right? And they're studying of a bacteria. So look at the cystopathology. What are they studying? A study, see there, study. Ology means a study of the cells. Cystogenics, the clinical laboratory, that's pretty much, CILA is another term that they use. You have CILA variant test. These are some of these terms that you will see as well. But just, it's not a lot. You might see it. So just be aware of it, okay? So definition, identification. See that term, right? Identification, forensic, gross. This is, see the examination of a specimen. When they basically send the specimen to the lab, you'll see that term when you're dealing with like panels, okay? All right, hematology, and this is when they're studying, right? It's a specialty, medical specialty. So ology, medical specialty, right? All right, hematology, study of, there you go, in vivo, right? You'll see that it's common, but it's not that common in this section. Microbiology, study of microorganism, microscopic, see, examination, okay? Molecular diagnostics, measurement, mode cellular diagnostic, measurement of DNA, okay? Mycology, study of. So if you look in a lot of these things in the glossary of your AAPC study guide, like I tell you, go get that book, right? And it's very important that you know these terms per section. So when you're reading, you won't find a problem. This is not a lot of terms that we're going through, so it's pretty easy. Necropsy. So look over here. Autopsy versus necropsy. So the examination, okay, I need to get my blue highlighter right here. And then we're doing an examination right here. Okay, so now look at this one. It says autopsy of a dead body to determine the cause of death. But the necropsy is the examination of a dead body and organ to determine the cause of death. You're like, okay, which one of these are different? One is dead body and one is dead body and organs. So do you see the difference? And you might say, okay, so now that's why you have to, that's why I like this book, because it breaks down the keywords in sections. Okay, all right, so the panel, pathology, medical science, specialty study, practice. Okay, presumptive identification, so it's an identification of microorganisms, so that we are right here. Parasitology, qualitative, a test determining the presence or absence of a drug. You'll see the qualitative term. So now look at this one. You have qualitative versus quantitative right there. There you go. These two weren't. One is the presence or absence. One is identifying. One is determining and one is identifying. Please pay attention to these keywords. It takes time but patience, but it does help when you are reading these questions, and it helps you with your accuracy. You know, some student might say, why am I doing a video like this? It's very, very important to learn your keywords per section. All right, and semi-quantitative and virology. So what I need you to do is to focus on, all right, so focus on the difference between two terms. So let's go back to this one. So you see you have an OPSI here and you have an OPSI here. The difference between the two of them is necro versus auto. So you have OPSI and you have OPSI. So you pay attention to those terms. Look on this one more time. Qualitative and one is quantitative. All right. So I hope this helps, and talk to you next time.